Vanuatu is so close to Australia, but it's a step back in time.
Life in Vanuatu is supposed to be laid back and you sit under the tree all day, isn't it? Drink coconuts, but...
Vanuatu is one of the most disaster-prone countries in the world. We experience just about every disaster, from volcanoes, cyclones, earthquakes.
Vanuatu is sometimes a difficult place to live for those to access healthcare, so
we have people that don't have access to Panadol and they've got, you know, aching teeth. Anything we want, we just go and get in Australia. Here, they go without.
In Luganville, we only have the Northern District Hospital, which is the government hospital. Not just Luganville, but all throughout the country, health services is not where we expect or we hope, you know, it should be. You get people, you know, children, older people, and dying of, you know, cases that can be prevented.
Some of those friends we'd made since 1993, they were getting sick, they had serious illnesses, or some of them even died. That was beyond what happens in Australia. These were people in their 40s and 50s. Life is not easy. God has it planned out, and we don't know the beginning from the end, but He does.
Very close friend of ours called me up one night and said he had a dream. I asked what's the dream? It's about the medical quality health service for the people in Luganville. I asked if I could jump on board with him. That night we agreed, and that's where it all began.
We didn't have a lot of money. We'd fundraised a little bit, and we had a few family and friends that helped out, and we had to get a loan. So we got that through the local Churches of Christ in Queensland. So that's how the clinic started. So we registered the charity in 2012 and we opened the doors.
First week, there was no patient. So we pretty much just hang around in the waiting room and we were just playing games, waiting to see if someone walks through the door.
We walked the streets handing out brochures. We went out to the resorts and gave all their staff free health checks, talked to them about first aid, just letting the resorts know we were here for them. We went to the local churches and gradually people trickled in.
Clinic is very much respected in the community, and we've seen that with the growing numbers and people coming back, and they are very grateful. Here that's quite nice is they're very grateful for the smallest, the kindness, the fact that we speak kindly to them. It's such a thing that I often get.
So usually during the day or a week we get to see like around 30 morning and then let's say 20 plus in the afternoon. So it depends on how many nurses and doctors are here.
And over time it just picked up and 12 years later it's over 10,000 patients a year. We started to do some rural visits, so we linked up with the Ministry of Health's rural department and went out and did some rural visits into the villages, and that sort of helped spread the news as well.
Check the eye blood sugar because most of them they were living too far to come to the clinic, so most of them they can afford to pay the like taxi fare to come to the clinic. So
people are unsure what to do with stroke victims or amputees or cerebral palsy children. So while the hospital gives them some direction when they're in there, then they go home, and then there is disability associations here, but they're more active in Port Vila than they are here. And we just fill in those gaps in the places that this sort of thing isn't happening here.
I also do a lot of wound care. There's a lot of wounds here. And it's one of the big things that we've kind of grown in the clinic. Before, there was only very basic wounds here. Up at the hospital, they have very limited in what they can do.
I went to the Central Hospital and they said they're going to amputate my feet. And I said, no, I want to save my feet. In the clinic here, in the Medical Center, they give hope to patients. And that's why I'm still walking around. So I thank God for that because these two things, like they have the hope and they have the knowledge and they also have the equipments. So there's a lot of things contributing to that. But to me personally, I thank God that they can have the hope for somebody to give them another chance to be useful in the community.
There's a lot of amputees here, particularly especially diabetic wounds, because that's a big problem here. And here they cut off legs very quickly. Don't necessarily need to be because they don't have the wound care capacity up at the hospital.
Would you mind sharing what happened to your foot?
Orang ni selitip, orang ni salaman. Stick by slipper. Got it. 2-3 days.
And did you have it amputated at the hospital?
Yes, few first time, few.
Okay.
Yeah.
Sorry. So that you can walk around.
Medical Santo has been growing and is growing too fast for us. So that puts us in a bit of a situation where we have to make sure that we get volunteers, the staff. We need a permanent doctor.
We need a doctor, a permanent doctor all the time. So we need some funding for a doctor. That is a really important thing. And to keep that continuity. We have volunteers come and go, but we need that stable person. The last few years, the donations have gone down. During COVID, there was a bit of donor fatigue or something, and they've never come back up. We need donations for medication and dressings. That's another thing. We have a lot of diabetic ulcers and we do wound care. So we can save limbs. We save toes, we save feet, we save legs.
We believe God put this in our heart to do this, and we just have to keep our focus and not let the situation around us, the situation we face, take our focus away from God. And we're human, we're always limited. Right at the beginning, like my friend Alan always tells me, I'm running out of patience. I said, ask God for more patience. We run out of patience, but God is still always there.
Maybe this is not for camera, I don't know. It's not easy. Life is not easy. But we are so fortunate. For us in Australia, we are so fortunate. I ache sometimes for these people, for my staff here, the trials they go through and the troubles they have. And I'm not trying to be pious because I'm not at all a super spiritual person. I'm just a fallen person that's trying to do God's will. I can't preach and I can't teach, but I'm good at organising money and I'm good at organising people. This is our way of doing that. We're just here to make it all happen. And, yeah.